Do you ever feel lonely? Well, you're not alone. A new study from Cigna says most Americans feel lonely, and the group most at risk isn't the older generation, it is one of the youngest. Researchers found loneliness is a major threat to Americans' mental, physical, and emotional well-being, and it can have huge consequences. Dr. Doug Nemecek is Chief Medical Officer for Cigna Behavioral Health, the global health service company that conducted the study, and he joins me now from Minneapolis. Doctor, thanks so much for being with us. Can you first explain what loneliness is exactly for the purposes of the study?
Sure. Thank you for having me on with you today. Loneliness is defined as a feeling of being alone or lacking social connectedness. And at Cigna, as a global health service company, we've been hearing more and more from our customers and individuals calling us that they're feeling lonely, alone, and disconnected from others.
So certain demographics in the study were worse off than others. Generation Z, which is adults between the ages of 18 and 22, were the loneliest generation. Why would that be? That seems to be sort of the prime of your life.
We looked across all generations, and you're right. As you said, we were very intrigued to find that the youngest generation of 18 to 20-year-olds actually felt the most lonely. And in addition, they also felt that their health was worse than the older generations. We can't really point to any causation from this, but it's interesting, and we do want to follow up on this and continue to work on ways that we can impact loneliness in that generation.
So, Dr. Nemecek, what do you find most alarming about this study?
One of the very interesting things that we found was the connection between loneliness and health. So from a health standpoint, other research has shown as well that loneliness impacts heart disease, diabetes, depression, substance use, and overall feelings of health. But what was nice about our study is we identified that those people who have meaningful in-person social connections, those who are engaged with others at work or at home, feel less lonely, feel more healthy, and are more engaged in their communities.
Now, we see there that the risks associated with loneliness include all sorts of health issues, like you said. I'm curious, though, whether the study looked at the role that technology may play in increasing loneliness. Constantly, we feel that we're so connected to people, but we're actually not having face-to-face interactions. And especially since it seems this younger generation is impacted, do you think that technology is playing a role here?
We actually looked at that as well. We hear all the time about social media and being connected. What our study actually found, however, was that the level of attachment with social media really did not impact loneliness one way or the other. What that means really is I could have 1,000 or 10,000 friends on Facebook, but it's the meaningful in-person relationships that I have with other people that actually keep me from becoming lonely.
Right. Well, it's good to hear that it didn't necessarily have a positive impact, but it didn't necessarily have a negative impact either. So what are some ways people can strive to not be lonely? What do you think is most important for people to know after seeing this study?
Well, we're excited by this study and really looking forward to continuing the dialogue and working with people, clients, employers, communities to find solutions that can impact loneliness. And all of us hearing this can just make an effort to meet with somebody, have a cup of coffee, and have a meaningful in-person conversation is a great first step for all of us to start to impact this.
All right, Dr. Nemecek, thank you for your time.
Thank you very much.